This podcast may not contain all the information on the covered topic that is important or relevant to you. You should not place undue reliance on the accuracy, fairness, or completeness of the information presented. The views and opinions of the presenter are not the views and opinions of HCA Healthcare and should not be construed as an endorsement. This content should not be used as a substitute for independent clinical judgment. Anyone with questions or concerns about the covered topic should consult with their healthcare provider. This HCA Healthcare podcast is intended to inform providers on our hospital's medical staffs, our employees, and other interested parties.
Welcome to Self-Care for Caregivers, a wellness podcast series brought to you by HCA Healthcare. I'm Dr. Frank Drummond, National Medical Director for Behavioral Health Services. Today our topic is how to develop a sustainable meditation practice. And we're very fortunate to have Kim Colegrove here, the founder of Pause First Academy and author of Mindfulness for Warriors. Hello, Kim. Thank you for joining us.
Thank you for having me. I'm happy to be here.
Just for starters, one reason I find your work so interesting is we see the advice everywhere that we should all be developing meditation and mindfulness as a tool for resilience and self-care, but no one really addresses why it's so hard to develop a personal practice. Can you start by giving us an idea of what you've seen related to this and how it's influenced the work that you're doing?
Sure. I do agree that it's difficult to get started, primarily because it's a brand new habit. And I think probably the biggest obstacle for most people is training your body and your brain to allow you to sit and be still, because that's counterintuitive to almost everybody, because we live in such a busy, active society. So we're always on the go. It's counterintuitive to sit and do nothing, especially when it feels as if nothing's really happening. So I think that's where the science and research is helpful.
With meditation, there is an acknowledgement that your mind is full of lots of voices and thoughts going around. So you're saying that also we should acknowledge that physically our body is pushed to move around and be fidgety, and it's about the mind and the body and finding that stillness and working towards finding that. Is that kind of how you think about it?
It is. I think you said that well. It's really typical for the brain to become very active when we try to sit still, and also normal for the body to become active and fidgety and uncomfortable. And so in the beginning, there's a little bit of sort of working through that.
Right. I know the primary complaint from caregivers, first responders, et cetera, is sleep issues. And one thing people report to us a lot is that they get that fidgety feeling when they lie down. They don't lie down and close their eyes and get rest. They actually find themselves moving around a lot and actually making things worse and getting worked up. And this is exacerbated by all the other things in the environment and the stresses of the world right now. So that's a common complaint, and I think it's something to work on training yourself to be better at. Can you tell me a little bit about the Pause First Academy and the work that you're doing there?
Sure. I originally taught meditation and mindfulness to individuals, and then I taught small classes, and then I got into corporate work, and I was teaching meditation and mindfulness in corporate settings until I turned my attention in 2017 to first responders. So I developed a training and started working with law enforcement first, and that really caught on. And before I knew it, I was offering meditation and mindfulness training to law enforcement, all first responders, healthcare professionals, mental health professionals. And over the course of a couple of years, I met some individuals who were working in these professions, who were also teachers and trainers in their own professions, so law enforcement, fire, EMS, and they had a passion for wellness, for being well themselves and teaching other people to be well. So in early 2020, I brought on some additional trainers to come and work with me and do what I was doing, which was offering meditation and mindfulness to these specific audiences. And we started to talk about the opportunity to offer more than just meditation and mindfulness, to offer some additional holistic wellness modalities. And our idea was that we would all, hit the road and train, and then COVID hit and everything shut down. So I created an online academy, and that is Pause First Academy. And I and my trainers now offer holistic wellness, work-life balance, resilience training, primarily online. Eventually we'll get back in classrooms and conferences and conventions when the world fully opens back up. But for now, we're offering it all online, and we're really focusing on frontline folks.
Interesting. What a year for law enforcement and frontline health workers, right? This has been particularly stressful.
Oh my gosh. Like nothing before.
Mm-hmm. That's really great. If we could talk somewhat about developing a personal meditation practice, if you wouldn't mind walking through what you've developed and what you found to be the most consistent, reasonable, effective way to do this?
I think a strength of mine is introducing these formerly New Age kind of topics to people who might be a little bit skeptical. I think one of my gifts is kind of bridging that gap between people who are new to these concepts, people who might be a little bit skeptical, and these kind of esoteric practices. So I developed a really straightforward, kind of mainstream, plain languaged way to teach meditation and mindfulness. My original training is in transcendental meditation, which is a technique. My parents were meditators, so they had me trained in TM when I was 10 years old in the 70s. That's not what I practice anymore, and that's not what I teach, but that was definitely the foundation that helped me create these methodologies that I ended up using to teach people. And I feel like I just simplified it, and I use very straightforward, plain language and simple steps. So I recommend people work up to 15 minutes a day. I start them by teaching them 3 simple steps to get started. And I think that kind of takes some of the pressure off with people. Meditation can be such a big, overwhelming, philosophical, new agey, hippy dippy kind of a concept for some people. And I think boiling it down to, it's just a daily exercise, and here are 3 steps you can use to get started.
That sounds really great. I do think that boils it down to the big problem is that it feels like a mountain to climb when you are going to sit down for 15 minutes and do nothing, right? Like to just be very blunt about it. So what are the steps that you recommend?
I call the 3 steps the 3 Bs. I think it's really easy for people to remember the 3 Bs. And the 3 steps, the 3 Bs, are breathe, body, be. I just sort of teach people how to utilize each one of those steps to ease themselves into a meditation. And then I'm always reminding people when they sit to meditate, at that point of choice where they feel like nothing's happening or they feel anxious or fidgety and they want to get up, I always remind them this is an evidence-based practice. So I do try up front to give them some of the research, some of the evidence that science is telling us that this changes, the improvements in body chemistry, in brain improvement. I offer those, I give them a little bit of that information. And then as I teach them the 3 steps, the 3 Bs, I ask them to reflect back on the science and use that to anchor them in, to encourage themselves, to inspire themselves to sit and work through those 3 steps. I also encourage people to start small. If you can only sit for 1 minute or 2 minutes now, then do that. Use these 3 steps, sit for 1 or 2 minutes. And then as you can, as time moves along, add a minute here and there and kind of work your way up.
Can I ask you, as presenting this evidence-based science to non-scientists, what pieces of that resonates most with your audience, or your students?
There's a lot of research about the benefits to the brain. And there's actually a really great article that I can't believe is about 10 years old now, but it's some research that came from a Harvard neuroscientist. And there were a couple of really great studies, one in 2005 and one in 2011. And there's an article called 8 Weeks to a Better Brain that, in a very straightforward, simple way, explains the findings. So I just point to that. I ask people to look for that article. And with first responders, I talk to them a little bit about two main areas of the brain: the amygdala that controls the stress response, and then the prefrontal cortex. And I point back to that Harvard research. I do think that the research on brain activity is what speaks to people in these environments, in these audiences, the most. It's very tangible. It's very easy for them to understand. And then when they are trying to decide if they're going to try and create this new habit or not, they think, gosh, maybe I'm operating with a bit of a traumatized brain, and maybe this is a tool I can use to improve my own brain health. I think I'll give it a shot.
Interesting. So I'm a psychiatrist, and when I prescribe a medication, I always try to start with a why. For example, you're having issues with depression, with low mood, crying spells, the symptoms that I'm seeing, and that is this medication is going to hit those symptoms specifically to try and help people understand why I'm prescribing it and what will happen when they take this medication if it's working. So what are some of the whys that you are able to present that resonate with people to practice meditation?
Yeah, with the frontline kind of people, the people that encounter a lot of emergencies and stress and trauma and secondary trauma impacted and affected by the trauma of others. I talk about how the amygdala, the part of the brain that controls the stress response, becomes overactive or can even become enlarged, and how that turns on the stress response. And that's really easy for most of us to understand. That makes sense. And then I talk about how meditation has been linked with increased activation and even increased gray matter in the prefrontal cortex, which controls executive functioning. Now, I'm not a psychiatrist, so I explain this in very layman's terms. Mm-hmm. But and the idea that you can use a tool like meditation to increase activation in your prefrontal cortex, which controls our executive functioning, which can improve decision-making and that really important functioning that we need when we're in a crisis or when we encounter a traumatic event, so that we're not operating 100% from that stress response.
So what I'm hearing is there's a bit of healing that can go on with meditation, with past exposure, but also a bit of protection as you continue to do this work and exposed to trauma.
Absolutely. I do believe that is what research is showing us, that there are some tangible, quantifiable improvements that can happen in a pretty short time. And there's an exponential benefit that you gain by continuing and adopting meditation as a regular exercise.
As a psychiatrist, I will say in our field, our approach to trauma, PTSD has been, number one, not very effective from a medication perspective, and even slow with the therapy. I think this is the year that it's time to address trauma more broadly and look at things like meditation, self-care, wellness, and ways to heal from the inside out using these types of techniques, because they do seem to have a more robust, lasting effect. That's my impression now.
I agree wholeheartedly. I mean, one of the quickest ways for me to connect with the audiences that I work with is when I connect physical fitness with mental and emotional fitness. So, for example, when we talk about the internal, external, you can move your body around and get physical exercise and lift some weights and some things like that, and you're going to improve your physical health. You can also take a diet pill to keep the weight off. I mean, if you need to take a diet pill to take some weight off, I'm not a doctor. I'm not going to tell you to stop taking the medications. But you can also exercise and move your body around to help you develop the physique or the body that you're wanting to develop. And I kind of think about meditation and mindfulness like that. We're always looking for external things to make us feel better or to change us internally. But I think at the same time, we've got to find that balance where we use our own internal resources to help us balance too. So wellness from the inside out. And, we can try these exercises and use them with some discipline and some reverence, and we'll start to feel the benefit. But if we need science and research to help us get started, something for us to sink our teeth into, something we can believe in, then the research and science is telling us we can help balance our mental and emotional health from the inside out. Meditation is one tool we can use. And that's empowering. That's empowering to think that you have the ability to help balance your brain functioning and balance your body chemistry. I say, why not do both if you need to? And then, see if you can use these powerful tools to more and more come into a place where you are healing more from the inside out. You're balancing more from the inside out.
Right.
It really puts you in the driver's seat, really puts you in control. It's very empowering, but it's not easy. It's not, I don't want anyone to think that I'm saying it's a snap and it's easy. It takes a little bit of discipline and work, just like improving your physical fitness. Right. You can't exercise once, and be more physically fit. It's got to be a regular habit.
And for the benefits, I will say the price is right, and the amount of time invested, the payoff is very great. So what has been your experience? So you're going to put in the work. It helps me, and I think it helps some people say, okay, if I do this for 3 months, it's going to get easier. What's your advice around that? Or how do you coach people into sort of putting the work in early, and then it becomes people that I know that meditate regularly then do it automatically, really anticipate it, they can really feel the benefit and they've demonstrated the benefit. So what's your advice on how long it takes for it to really become part of your routine?
Gosh, I think that's such an individual thing. It's really hard to say. Some people take to it quickly, and once they decide to create this new habit within a week, it's just, part of their life, like brushing their teeth. It takes longer for other people. I would say the biggest problem for people, I think, is starting, feeling like it's not working, and immediately bailing out. Right. It doesn't work. I hear this all the time. I can't do it. You don't understand. I have a type A personality. I can't do it. So I think really giving yourself a break, starting small with 1 or 2 minutes a day, whatever you can do. But it does take a little bit of commitment and discipline from the individual. And understanding the full picture of meditation and mindfulness. Meditation is not necessarily going to make you feel calm and peaceful every time you sit to do it. You're going to work through some things. You just have to know that you're going to work through some things and commit to sitting. And, make it a part of your daily life. Decide this is a gift you're going to give yourself. Seek out some of the research so that you can trust that there are benefits, and then make that decision. This is a gift I'm going to give myself, and I'm going to commit to it. And in pretty short order, you'll begin to notice some shifts and some changes.
And daily is key, right? Every day, I think, is key.
Daily is key. But then again, if you have a day where you absolutely cannot fit it in, you absolutely could not settle down for a day, that's okay. Give yourself a break. For people who are perfectionists, for people who are really hard on themselves, you missed a day. That's okay. Regroup the next day and consider it a regular practice, a very regular practice. You do need to do it daily or nearly daily to reap those benefits and to gain that exponential benefit.
Mm-hmm. Yeah, I think that's key to point out that's the work, is doing it daily. But don't beat yourself up if you miss a day, but that's your goal. A lot of our audience today are providers, physicians, nurses, healthcare providers. I think also it's okay for them to prescribe it, to encourage it to people, to give them some of the science and say, I think meditation is going to be something that's going to help you through this period of time and help you heal. And here's some science behind it. here's a website that introduces it to share with their patients and prescribe it, that does influence people's behavior if a healthcare provider tells them to do it. It's the same with stopping smoking and reducing drinking. People know they should do it, but if it's told by a professional, that can actually influence their behavior as well. So whatever can help people get there, I think is worth doing.
And giving people lots of options. So there are many, many different meditation techniques and mindfulness techniques, and many, many different teachers and authors. So encouraging people to spend some time doing a little bit of research and seek out something that works for you. Seek out a technique that works for you. And don't give up if the first time you try, you don't connect with it, it doesn't work for you. You don't enjoy that kind of practice or that technique, because there's a lot out there. Just look for websites and resources and books and podcasts and apps.
Right. And then just encourage people that there is science behind it, that it can produce healing, that it can produce the resiliency for future exposure to trauma. The stress of the pandemic hasn't gone away for most people, for example. Do something now. I'd like to talk to you about your book, Mindfulness for Warriors. Can you tell us a little bit about the background for that and what your experience has been with the book?
Yes. Well, I lost my own husband to suicide in 2014. David was a first responder. He was a police officer for 8 years, and then he was a federal agent for 22 years. And when he died, it was very unexpected. He had just retired. And I really needed to understand what had happened to my husband, why he unraveled the way he did. And that kind of led me on a journey of discovery about stress and trauma. I really believe that those 8 years in a patrol car, I believe those were hugely impactful. And one of the reasons why my husband suffered with the symptoms of stress and trauma, anxiety, depression. So I started to look into that. I did some research, and I began to understand how accumulated stress and trauma really impacts, frontline people, first responders, veterans, active military, healthcare professionals. And so I put together this simple little book. I tell the story of my husband, which is really the story of what can happen when you allow accumulated stress and trauma to go unattended and unprocessed. And then I interviewed 9 first responders who all struggled or suffered similarly to my husband. And they shared with us how they found a healing path, what tools they use, and how they stay healthy. And that is the most impactful part of the book, because these are military veterans, first responders, typically stoic people who suffer in silence, and they were vulnerable enough to share with us. And I think that's important for frontline people, because when you see people who understand the work you've done, understand what you've seen, what you've endured, and they're honest that they weren't doing well mentally and emotionally, and they share the tools they use, I think that can be very inspirational and motivational for people. And then the third part of the book is just a very simple how to begin learning about and using meditation and mindfulness.
That's great. These are careers that are rewarded for being tough and not showing emotional or not having emotional responses, right? A policeman has to manage a very stressful situation, regardless of their own history, and get to the other side to help people get to a safe place, to secure the situation, to understand the environment, to without actually bringing their own emotions in very much at all, which can be pretty damaging, right? I mean, they're sort of holding it all in over years, like you said, at times.
Exactly. And same thing with, ER folks and firefighters and clergy largely. There are a lot of these professions that their entire job is about not showing emotion, just handling the situation, no matter how traumatic it is, and then just powering through, just moving on day after day after day. And I do try and encourage people to take a look at that and to begin to acknowledge and be honest with your own mental and emotional well-being, because if people think they're going to work in a profession that's this taxing and traumatic for 30 or 35 years, not address the mental and emotional impact of the job, and then retire healthfully, I have news for them. It's very common that everything that you've endured and held in throughout your career is very likely to begin to surface as you head towards that retirement that in your mind was going to be happy and healthy. And so I think it's really important for people to take an assessment and work on that now. Agreed.
Here we're working on elevating trauma-informed care, which I'm sure you're familiar with, but for us that means understanding that everyone has experienced some sort of trauma and will continue to experience it either that day or during childhood or during, at work or at home. And being sensitive to that, and this is all employees and all patients and all people working together in our healthcare settings, the way we address people, the way we talk about things, sensitivity to language, et cetera. And I really appreciate what you're doing because it takes some of the stigma out of acknowledging that trauma has a significant impact on us and is a real thing that sometimes we bring into our lives by the jobs that we take. Sometimes we don't ask for it, but everyone experiences it and it does have real effects on you. And how can you address that? Well, meditation, mindfulness, sometimes that's the fastest way in to let go of some of those effects of the ongoing or historic trauma that you've experienced. Would you agree?
I agree wholeheartedly. I don't want anyone to ever think that I'm suggesting, however, that meditation and mindfulness are the end all be all, the panacea, just meditate and everything will be okay. These are really powerful tools that can help you balance and find a healing path, because the whole point of these practices is to bring your awareness into the present moment. And when you bring your awareness into the present moment, that's when you can address and be honest with what you're feeling, how you're doing. My hope is that that will lead a lot of people to, for the first time ever, reach out, talk to a friend, seek professional help, look for a counselor or a therapist, attend a peer support meeting, something like that. Like that. Meditation and mindfulness are just, they're a really powerful tool and can be it can be lifelong viable stress reduction tools and so much more, because there's a deeper dive that people in these professions need to take to, like you said, to examine even childhood trauma that they brought into this work.
I think it's an important tool that is so easy and accessible to everyone, that the work you're doing is kind of amazing because it introduces it in a way that everyone should build it in, even if it's a minute a day for a while, and then build it up as you can over time and understand the benefits from it, but then also to understand the effect that trauma has. And we'll include some links to resources for people, for group support therapy. Sometimes you do need a psychiatrist. Sometimes you need more or less of an intervention, like you said, something to open up to friends or your spouse about, and sometimes it's a therapist and sometimes it's a group. There's lots of resources for people when they're ready, and that should be acknowledged. This is not a cure-all or a panacea, but it's a very important way to make yourself stronger for future trauma, which is what I'm very interested in as well. And you call it warriors, and it makes you a better warrior when you're dealing with either what's going on at work or in the emergency room or in your life.
Yes, and really, if you think about it, we're all warriors in one way or the other, because we're all forced to fight through things in our lifetime.
Well, I really appreciate your time today, and thanks for taking the time to talk through some of this. We'll include some links to your book, the Mindfulness for Warriors, and your Pause First Academy, and also some of the other resources that are available for people that are experiencing trauma or associated symptoms with trauma, to make sure that they do care for themselves and care for themselves in the future state as well. Thank you so much for your time today.
Sure. And I would just say one more thing.
Sure.
If anybody is interested now, like, oh, my curiosity has been piqued, they can pop over to my website and I have some free resources. So if somebody is new to this idea, they can pop over to the website, which is pausefirst.com. And I have a 1, a 2, a 3, and a 5-minute relaxation audio. And there's a full 15-minute guided meditation there. That just might be a good way for someone to experiment and try it out.
That sounds great. And I just, the takeaways for me are many, but in particular to familiarize yourself and the people that you work with about the benefits, the physiologic and the science behind meditation and mindfulness as part of introducing yourself to the practice. And then start small, commit daily, give yourself some time. Don't beat yourself up about it. Integrate it. Find where it works for you and when. And use other tools to help guide along the way, like recorded things. There's apps that are available. There's a lot of ways to try to get into it that you'll find one eventually if you keep trying. And it's worth doing.
Yes, absolutely.
Great. Well, thanks again, and great talking to you. And I look forward to seeing the future work and the books and things that you're able to put out in the future.
Thank you for your time.